Type 2 diabetes. A brief presentation by Kelly Sharko. To better understand what is diabetes, let's look at the meaning of the word. Diabetes comes from the Greek word diabetes, dia meaning through, its prefix, and its suffix betis meaning to go. This is because this was a term used to generalize diseases that were categorized by excessive urination. Diabetes mellitus is characterized by sweet tasting or hyperglycemia of the urine due to excessive amounts of glucose in the urine. Diabetes mellitus falls under both type 1 and type 2 diabetes. Diabetes insipidus is characterized by polyuria or the diluteness of one's urine. Because we'll only be discussing type 2 diabetes, let's differentiate it from type 1. In type 1 diabetes, the body is not producing insulin. In type 2 diabetes, the body is producing a sufficient amount of insulin. However, due to the development of an insulin resistance, insulin no longer acts as a proper regulator of glucose to allow it to go into the cells and thus be used as a source of energy. Time to look at the risk factors and causes of type 2 diabetes. We've already discussed insulin, its resistance, and glucose unable to enter the cells. Now let's look at how this insulin resistance occurs. Insulin resistance can occur due to your lifestyle. Physical inactivity and obesity show a very strong correlation and association with type 2 diabetes. Age, diet, smoking, and overall health also show strong associations with the development of type 2 diabetes. Genetics also seem to play a strong role in the development of type 2 diabetes. Certain gene mutations do show an association, but are not an individual cause, but more of a predisposition. Certain ethnic backgrounds, such as African Americans, also show higher rates of acquiring type 2 diabetes. Individuals with a family history of type 2 diabetes will also be at a higher risk for developing this disease. Symptoms to identify type 2 diabetes range from very mild to extremely severe. These include thirst and hyperurination, fatigue, blurred vision, tingling and numbness in the hands and feet, wounds and sores that won't heal, reoccurring yeast infections or vaginal infections for women, and excessive hunger with an unexplained weight loss. Individuals with these symptoms can be tested for type 2 diabetes by getting their blood sugar tested. A blood sugar of over 126 milligrams per deciliter is indication of type 2 diabetes. A blood sugar level of over 99 milligrams per deciliter but under 126 is indication of pre-diabetic individuals. The treatment or management of type 2 diabetes all flows around managing one's blood sugar levels. This can be done by the individual naturally through a healthy diet and exercise. However, lifestyle changes such as these are difficult and may not prove to be enough for the individual. Other treatment can be prescribed, such as insulin therapy. This is where insulin is actually injected. However, there are many oral medications that perform a wide variety of actions, all helping to maintain a blood sugar level and keep the body in homeostasis. When type 2 diabetes is left unmanaged, it can lead to a series of complications throughout the body, including heart and blood vessels, gums and teeth, kidneys, nerves and eyes, and skin and foot complications, most well known for the foot amputations that commonly occur. with out of control diabetes. According to the Center for Disease Control and Prevention, as many as 1 in 3 U.S. adults could have diabetes by 2050 if our current trends continue. To put that in perspective, currently we are at 1 in 10 adults right now. Thanks for watching, and here are my references for more information.